Hello everyone, I'm just going to share with you my office space here in my work. So I'm just finishing now my report and my ordering of equipment, and I'm ready to go. I'll just show you quickly the office. So this is our office. And there's another room there. Manager's office, our bulletin board, and our longer office. So other rooms up there. Hello everyone, welcome to my channel. And hello to everyone around the world. As I understand, I've been reaching out to different people around the world already. So this is again to thank you all for listening to my videos, and hopefully you learned something from it. For those of you who's just started watching my videos, just to say that I'm doing these vlogs to help other people, especially those who are internationally trained physios who's trying to get a job or get registered or start up their professional journey as a physiotherapist here in the UK. It's nearly 5 months now since I started my new job, and there's lots of learning already in this role. Just for you who's just new again, I've started a community job role as a physiotherapist, intermediate care. I'm dealing with patients who get discharged from hospital and supporting them at home. So we're a team of therapists, social workers, as well as support workers as well. So it's lots of liaising with the MDT. We have OTs as well, OTs and social workers, and lots of dealing with social issues with patients. We're also partly doing some OT work because we're ordering equipment as well, and assessing the needs for equipment and aids that they may need at home. And talking about that, my topic for today is about MDT working. And this is more about for band 6 and maybe for band 5 as well, because this was one of the, as you've listened to my previous videos, I've mentioned that as a band 6 you should be you should have a greater awareness of the bigger picture of in your works, in your service, the NHS, and the people working around you. So you should be very familiar with the MDT professionals around you and how can they help you in your job role. And as a band 6, you now have a little bit of confidence of not just liaising, but you're also like working together and doing some clinical decision making with your patients, with other MDTs, for example, an occupational therapist or in my team, social workers. It's not just as well like talking about them, you share you share your views as well, and help each other in making decisions, as well as even delegating as well if needed. So since you're a band 6, it's also okay for you now to delegate in your with your colleagues, an OT or a social worker, for example, having making them visit your patient for a concern that you have, things like that. So yeah, so as a band 6, that's now how you work. So you're in full grasp of the MDT working in your workplace. And yeah, regarding my job, it's a lot of working together with social workers. So we have MDT meetings with the patient sometimes, and attend with the family in their homes and discuss things. With occupational therapists, for example, you want to seek their opinion about something. For example, their sitting condition, or for example their cognition, and how that affects their daily activities. And not just MDT doesn't just work internally in your service. There can be chances as well that you'll be working with the multidisciplinary professionals outside your workplace. So for example, you're liaising with your GP, the consultants from the hospital, the orthopedic consultants, for example, in my case. You liaise with the different people where you can refer to, for example, the district nurses, the rapid response team. That's in my case, okay. We also liaise with, for example, dietitians if needed, the FOLS team, which is another group of rehabilitation professionals, and there's also like other specialist teams, for example the community stroke team, or some rehab units, or like other intermediate care teams where they can have inpatient rehab, things like that. So this will I'm talking about a community job role, but for if you're working in acute or applying in an acute, it's not much difference, but it's just more closely knitted MDT working. Although sometimes when you're already discharging patients, you'll be it's a physio job sometimes to find the where the patient should be referred to. For example, depending on your pathway, you should be familiarizing yourself to the pathways where you're going to work. So it depends on those pathways where the patient should be referred to after discharge, and what's the deadlines for you before discharging, and thinking about discharging and referring them to appropriate services. Or it can just be discharged home with either an ESD or community rehabilitation referral. It depends. So yeah, it's still a key thing that you do, which is multidisciplinary working, and you should be, as a band 6 especially, you should be confident on your role and how you play along with these different professionals around your work. Okay, so that's just one topic that I'd like to share, and hopefully I can share other things as well. And for those of you who just listen to these videos, again, if you're a CSP member, you wanted help or support on anything, please make use of the mentoring scheme. Check out the website and look for the web mentoring scheme, and then look for my name, register and look for my name, so we can maybe work together. Also, you can also subscribe to my channel and comment on the box or in the comments below if you have any topics that you want me to share in my videos. Okay, so until next time, thank you very much for listening. Bye.